So, still talking about skin disorders, but we're going to move into the specific area of skin infections and tumors. So, we're going to describe the viral infections of herpes simplex and warts. We're going to compare skin cancers, looking at different lesions and predisposing factors and how they spread. And specifically, we're going to talk about squamous cell carcinoma because it's one of the most common skin cancers, malignant melanoma because that's the one that can kill you, and Kaposi's sarcoma because it's different and interesting. And then we'll also talk about the manifestations of some of these different infections. So, skin infections can be caused by bacteria, viruses, fungi, other types of microbes and parasites. So, lots of different causes for skin infections. They're often, usually, caused by opportunistic microbes from minor abrasions or cuts. So you get a little abrasion, now your skin barrier is broken, and opportunistic pathogens can get in there. But they can cause serious infections. Causative organism needs to be identified in order to treat appropriately. So you have to know what you're dealing with in order to kill it with infections, just like we talked about in chapter 6. So bacterial infections are common in the skin because our resident flora, we have that Staphylococcus epidermidis all over the place and Staphylococcus aureus all over the place. They can also be secondary, developing in wounds or pruritic lesions from scratching. So you can have primary or secondary bacterial skin infections. So cellulitis, it's also called erysipelas. I don't know the derivation of that word, and every time I look at it, I have to. But cellulitis is usually the cause, and it's an infection of the dermis and subcutaneous tissue. So it's a deep infection, and it's usually secondary to an injury. It might be iatrogenic, caused by another treatment. The causative organism is usually Staphylococcus aureus, sometimes Streptococcus, both of which are normal flora in our body. But Staphylococcus aureus is supposed to be in your upper respiratory tract. It's not supposed to be in your lower trunks and legs. So it's more common in individuals with restricted circulation in the extremities and immunocompromised individuals. So obviously, well, I don't know if it's obvious, but when you're immunocompromised, your immune system can't deal with your normal flora when they get in the wrong place. The area in the cellulitis becomes red, swollen, and painful, and red streaks may develop running along lymph vessels proximal to the infected area. So, usually, when it gets to that point, the person is in the hospital for IV antibiotics, and a lot of times very long treatments of IV antibiotics. So we're often in PT working people with cellulitis, and of course we're working on functional mobility. We want to get them home. When they get rid of the infection, they can go home and they don't lose mobility while they are in the hospital. Bacterial infections, besides cellulitis, can include furuncles, which that's just the weirdest word. Also known as boils, usually caused by Staphylococcus aureus at the hair follicles. They're often seen on the face, neck, or back, and they frequently drain large amounts of purulent exudate. So remember, purulent exudate is a huge indicator of infection. If you have serous exudate, it's not probably infected. Um, but purulent exudate, you know that there's a bacterial infection. The other problem with boils, besides the exudate, is they can auto-inoculate. So if it gets squeezed, it can result in spreading the infection to other areas of the skin. Carbuncles, another 14th century word, are a collection of furuncles that coalesce to form a large infected mass. And this is what this photograph is. So usually they need to be treated by draining and disinfecting and sometimes debridement and antibiotics. So you have to identify the bacterium. What if you have a resistant Staphylococcus aureus? You have methicillin resistant Staphylococcus aureus. Well, you're going to need something more serious, usually IV antibiotics. So don't mess with infections. So before it gets to the horrible stage, they will treat it with compresses to promote drainage, so compression to promote drainage, analgesics to provide pain relief from inflammation, and then the cut and drain the abscess, followed by antibiotics. And that is done in a medical setting, obviously in a sterile field, because you don't want to reinfect the area. Impetigo is a common infection in infants and children, but it may also occur in adults. It's caused by Staphylococcus aureus, and it's highly contagious in newborns. Lesions are commonly on the face, and transmission may occur through close physical contact or through fomites, like wipe your face with a towel, set the towel down, somebody else uses the towel. Um, so inanimate objects that transmit infections. Pruritus is common, leading to scratching and further spread of the infection. Obviously, that is a problem in children. Treatment is in the early stages, topical antibiotics. If the lesions are extensive, they may need systemic antibiotics. Antibiotic-resistant strains of Staphylococcus aureus are increasing in numbers, and the last I read, more than 25% of the community has methicillin antibiotic resistant Staphylococcus aureus as their normal flora. So that's a big problem. You can get local outbreaks of infection, especially like say the kid goes to kindergarten, they share toys and stuff with other kids, and then other kids get it. So it's highly infectious. Acute necrotizing fasciitis is a big problem. There's a mixture of aerobic and anaerobic bacteria in this, usually at the site of infection. Severe inflammation and tissue necrosis. It's usually caused by a virulent strain of gram-positive group A beta hemolytic streptococcus. The bacteria secrete toxins that break down the fascia and connective tissue, causing massive tissue destruction. So very, very serious. There's often a history of minor trauma or infection in the skin and subcutaneous tissue of the extremity. If you delay treatment in this case, you're going to have greater tissue loss, potentially amputation, and a higher probability of mortality. Systemic toxicity can develop with fever, tachycardia, hypotension, mental confusion, disorientation, and possible organ failure from septic shock. So pretty serious. And they treat it aggressively with aggressive antimicrobial therapy and fluid replacement, excising all the infective tissue up to and including amputation, excising um, any new infective tissue that develops, and high oxygen flow hyperbaric chambers to get those anaerobic bacteria. And amputation is a serious risk with necrotizing fasciitis, so a very serious skin infection. Leprosy, also known as Hansen's disease, is caused by a bacterium, Mycobacterium leprae. The chronic disease, and leprosy's been around forever, right? But they didn't know what caused it for a long time. Chronic disease is classified into three major types. The clinical signs and symptoms vary, but it usually affects the skin, the mucous membranes, and peripheral nerves. And damage of the peripheral nerves can lead to loss of limbs. The mechanism of the pathogen is largely unknown, and it's diagnosed through microscopic examination of a skin biopsy. The treatment is primarily with antibiotics, so they don't really know how the bacterium works its uh, evil deeds, I guess you could say, but it is treated with antibiotics. So that's good. Viral infections, lots of different viral infections of skin. One of the really common ones is herpes simplex type 1. That's the most common cause of cold sores or fever blisters. Herpes simplex type 2 is the cause of genital herpes. Both types of herpes simplex virus cause similar effects, just different areas. The primary infection may be asymptomatic. The problem with herpes simplex virus is it remains latent in your sensory nerve ganglia. So it's just waiting to be triggered by getting a cold or sun exposure or stress. And so it's just waiting there. Um, like some other viruses that remain latent in your sensory nerve ganglia, and we'll talk about another one in a minute. So, herpes simplex is spread by direct contact with fluid from the lesion. So, the spread of infection to other people is possible before you get lesions. So that's a problem because you don't know you have the, maybe you don't even know you have it and you can spread it to other people. So potential complications, if the virus spreads to your eye, you can get keratitis. Herpetic whitlow is a painful infection of the fingers, which results from herpes simplex virus. So it's a tricky little virus because it stays latent in your system. It can spread before you have lesions, and it can spread by direct contact with fluid from the lesions. So human papillomavirus causes warts, but it also, different types of it can cause cancer. So there are types 1 to 4 that cause warts. And they frequently develop in children and young adults. Plantar warts on the plantar surface of your foot are common. The infection spreads by viral shedding of the skin surface, and it may resolve spontaneously with time. Genital warts are caused by human papillomavirus type 6 and 11. Cervical cancer and head and neck cancer are also caused by human papillomavirus. So there is a vaccine for it now, which if vaccine that prevents cancer, I like that. That's a good idea. I think I was too old to benefit from it, but um, younger generations coming up can get it. You can also get tested to see if you have it in your system, which is good. And most people don't have it. Fungal infections or mycoses are most of them are superficial. Candida infection or yeast infection is often associated with diabetes because fungus like sugar and your blood has more of it when you have diabetes. They can spread systemically in immunocompromised individuals. So that's sometimes one of the ways that they identify that you're immunocompromised for one reason or another, is that you have more of these type of infections. Usually fungal infections are diagnosed from skin scrapings, and they become fluorescent in ultraviolet light. So they scrape the skin and stick it under UV light. It's also examined under the microscope, and the samples are cultured using specific fungal culturing techniques. So tinea capitis and tinea corpus are both fungal infections, and the other name for it is lice. So tinea capitis is head lice and tinea corpus is body lice. So tinea capitis head lice is an infection of the scalp. It's common in school-aged children. Erythema, redness may be apparent, and it's treated by an oral antifungal medication and getting it all out of your hair. Tinea corpus is body lice. It's an infection of the body, particularly the non-hairy parts of your body. It shows up as a round lesion with a clear center, and it's used to be called ringworm because of that round lesion with a clear center. Pruritus, itching may be present, and it's treated with a topical antifungal medication. Tinea pedis, also known as athlete's foot, it involves the feet, particularly the toes, associated with swimming pools and gymnasiums. That's why they call it athlete's foot. It might be part of the normal flora of our body that becomes opportunistic given the chance. And secondary bacterial infection may occur, and that is also treated with topical antifungal medication. There is a particular infection of the nails, a tinea infection of the nails, that causes the nails to, particularly toenails, to turn white and then brown, and the nail thickens and cracks, and the infection spreads to other nails. There are oral medications that are used to treat that. So other great infections that might show up in the skin are scabies, which is a mite that infests your skin. The females burrow into the epidermis and lay eggs over a period of several weeks. That is the grossest thing I think I'll talk about to you today. The males die after fertilizing the females die after laying the eggs, and the larvae migrate to the skin surface. and they burrow into the skin in search of nutrients. It's very itchy. It's intensively pruritic, and just really gross. Larvae mature, and then the cycle is repeated, and the burrows appear on the skin as tiny light brown lines. My hope for you is that you never ever have to encounter this. Um, ugh. Other infections, lice, body lice, head lice, pubic lice, pediculus humanus, corpus, captus, and pubis. The lice lay eggs on hair shafts. After hatching, the louse bites the human host and sucks the blood for the production of their ova. And the excoriations from the bites result from scratching. So, ick, right? Oh, thank God we're going on to skin tumors. So skin tumors, keratoses are benign lesions associated with aging or skin damage. Seborrheic keratoses are proliferation of basal cells that lead to oral elevation. Oval elevation may be smooth or rough. Um, Actinic keratoses are on skin that's exposed to UV radiation, commonly in fair-skinned persons, and the lesion appears as a pigmented scaly patch. A lot of times people will say, like, oh, I'm going on my trip to Maui, or my trip to think of a nice tropical sunny area, and they end up with a pigmented scaly patch and don't know what it is. And this is what it is. It's a minor skin tumor. It's an actinic keratosis. So the warning signs of skin cancer. So we talked about the warning signs of cancer, but skin cancer in particular, a sore that does not heal. That could be a warning sign of skin cancer. A change in the shape, size, color, or texture of a lesion, especially an expanding irregular circumference or surface. So that irregular border, that's a giveaway there. New moles or odd-shaped lesions that develop, or a skin lesion that bleeds repeatedly, oozes fluid, or itches. So that's one of the reasons why you get skin checks at the dermatologist, is to look for things before they get bad. So the general guidelines to reduce the risk of skin cancers are reduce sun exposure at midday and early afternoon. That's easy, right? Cover up with clothing, remain in the shade, wear a broad-brimmed hat to protect your face and neck. Apply sunscreen or sunblock. Protect infants and children from exposure and sun damage. So they didn't know about that when I was a kid. So I don't know, but so sun damage can to your skin can be cumulative over your lifetime. So the more you can protect yourself, the better, and don't let it develop into skin cancer. So the most common type of skin cancer is a squamous cell carcinoma. It's a painless malignant tumor of the epidermis. The lesions are most commonly found on exposed areas of the skin, but sometimes also in the oral cavity. So when you go to the dentist, they check in your mouth and they're looking for this. So either on the face and neck or at the base of your tongue, um, squamous cell carcinoma, the good news is it has an excellent prognosis when the lesion is removed within a reasonable time. So early detection. The invasive type arises from pre-malignant conditions. So squamous cell carcinoma common, but hopefully if you get it treated early, you have an excellent prognosis. Malignant melanoma is a highly metastatic form of skin cancer. It develops in melanocytes, so that's why it's a melanoma, from a nevus, a mole. It often appears as a multicolored lesion with an irregular border that grows quickly, changes in shape, color, size, or texture, and may bleed. The treatment is surgical removal, radiation, plus chemotherapy because it metastasizes really quickly and it moves quickly. So people die from malignant melanoma. So early detection is so, so, so important. If you have a mole that changes, get it checked right away as soon as possible. So the ABCD of melanoma. Melanoma is suspected in any nevus that shows a change in appearance, a change in the border, a change in color, or an increase in diameter. So you look at this, it has a variable color, it has a diffuse border. Um, it's, get that checked out. Um, Another type of skin tumor occurs with people with immunodeficiency. So one of the things early in the identification of AIDS early on was the incidence of Kaposi sarcoma went way up, and they couldn't figure out why. But it's Kaposi sarcoma may affect the viscera as well as the skin. Obviously, if it's on your viscera, you're not going to see it, but if it's on your skin, you will. Malignant cells arise from the endothelium in small blood vessels, and on the skin, it causes purplish macules, and they're non-pruritic and non-painful. In the immunocompromised patients, lesions develop rapidly over the upper body, and it's treated by a combination of radiation, chemotherapy, surgery, and biological or immunotherapy. So that's a pretty serious form of skin tumor, but it doesn't usually happen unless you are immunocompromised for some other reason.